Hey guys, today we're going to talk about fluid overload and dehydration with CKD patients. Fluid overload is bad. Our body needs about 60% water at all times. If you're above 60%, you're considered fluid overloaded. If you're below 60%, you're considered dehydrated. So the kidneys help regulate the fluids in your body, but of course, if you have CKD, the kidneys aren't really regulating much of anything. So what's fluid overload? Fluid overload is when you have an excess amounts of fluid in your body. That's really bad because it can cause your the fluids to compress against the organs of your body, including your heart. So how can you get fluid overloaded? Skipping HD treatments, especially if you only get treated 3 times a week. If you're skipping those, you can have excess fluid on your body. Not taking the medications that your doctor prescribes for you. Also skipping PD treatments for your PD patients. Not monitoring what you eat and what you drink. We gotta remember that food also contains fluids. Popsicles is a food, pasta is a food, celery is a food, strawberries are food. All of these have fluid in it. So if you're eating too much and you're not regulating your fluids, it can lead to fluid overload. Symptoms and signs of fluid overload include excess weight gain at a fast rate. In the morning, you could be 100 pounds. By night, you could be 107 pounds. That's excess fluid. Edema or swelling. You first notice it in your lower extremities, your legs and your feet, but it could get into your lungs, which can cause you to have breathing issues when you're laying down. You need 2 or 3 pillows to prop yourself up for you to actually breathe properly. That's a sign of fluid overload. Increased blood pressure. Increased blood pressure can lead to strokes. Strokes are bad. So make sure you take your proper meds. Make sure you don't skip treatments. Make sure you monitor what you eat and what you drink so you don't get fluid overloaded. Also, if you notice the rings on your fingers no longer fitting properly, they're too small, that's actually a sign of fluid overload. And puffy eyes. Now, dehydration. Dehydration isn't just, oh, I'm thirsty, I want some water. Dehydration is you have a target weight. I'm supposed to weigh 120 pounds. That's my regular weight. But now I weigh 105 pounds. I am dehydrated. I have sunken eyes. My blood pressure is low. Dehydration is not a good thing. Ways you can become dehydrated are diarrhea, vomiting, urination. If you drink a lot of coffee and you urinate a lot, that can actually lead to dehydration with CKD patients. Sweating. If you're a runner and you sweat a lot and you're not replacing those fluids, that can lead to dehydration. Signs and symptoms of dehydration. I said it before, puffy eyes for fluid overload, sunken eyes for dehydration. Those rings that were on your fingers, now they're easily just falling off and they're loose. Fatigue, weakness, passing out, becoming unconscious. Cramps is a big one. Cramps in your hands, cramps in your abdomen, cramps in your legs. You could be a little delirious if you're dehydrated. So take dehydration seriously. You can have a very, very, very rapid heartbeat because trying to compensate for that low blood pressure that you have because you're dehydrated. So how do I fix this? How do I not have this happen to me? You're scaring me, Nick. Like, calm down, guys. It's okay. Don't skip your PD treatments. And during your PD treatments, make sure you're using the right fluids. If you're at your target weight, don't use a red bag. It's going to dehydrate you. If you're above your target weight, don't use a yellow bag. You're going to stay fluid overloaded. HD patients, don't skip treatments. And know your dry weight. Know your target weight. If you see a tech or a nurse taking off fluid that's more than what they should be taking off, pay attention to that. Talk to them. Take your medication like you're supposed to. Monitor what you eat. Monitor what you drink. And live life to the fullest. Ciao.